A review on Parkinson's disease. Parkinson's disease was first described in 1817 by James Parkinson in an essay on the shaking palsy. It is a neurodegenerative disease, meaning it is caused by degeneration of neurons within the brain. Parkinson's disease causes motor and non-motor symptoms. Men and women alike are affected, regardless of age, race, or social disposition. The frequency of the disease is considerably higher in the over 60 age group, even though there is an alarming increase of patients even of younger age. What is Parkinson's disease? The substantia nigra, literally meaning black substance, is a small region in the brain stem, just above the spinal cord. It is one of the centers that could help control movements. Cells within the substantia nigra produce and release a chemical called dopamine. Dopamine is a neurotransmitter that controls movement and balance and is essential to the proper functioning of the central nervous system. Dopamine assists in the effective communication of electrochemical signals from one nerve cells to another. Dopamine released by the substantia nigra neurons lands on the surface of neurons in the other brain centers, controlling their activities or firing and thus regulating movement. In Parkinson's disease, cells of the substantia nigra degenerate and therefore can no longer produce adequate dopamine. When this occurs, neurons elsewhere in the brain are no longer well regulated and do not behave in a normal manner. This results in a loss of control of movements, leading to slowed movements, tremor, and rigidity. What are the symptoms of Parkinson's disease? Parkinson's disease does not affect everyone the same way. In some people, the disease progresses quickly. In others, it does not. Although some people become severely disabled, others experience only minor disruptions. Early symptoms of Parkinson's disease are subtle and occur gradually. At first, patients may be tired or notice general malaise. Some may feel a little shaky or have difficulty getting out of a chair. Advanced stage of Parkinson's disease is characterized by the following cardinal motor symptoms.
Tremor. The tremor associated with Parkinson's disease has a characteristic appearance. Typically, the tremor takes the form of a rhythmic back and forth motion of thumb and forefinger at 3 beats per second. This is sometimes called pill rolling. Bradykinesia. Slowness of motion is one of the classic symptoms of Parkinson's disease. Patients may eventually develop a stoop posture and a slow, shuffling walk. The gait can be erratic and unsteady and cause a person to fall. Muscle rigidity. Rigidity or resistance to movement affects most Parkinsonian patients. A major principle of body movement is that all muscles have an opposing muscle. Movement is possible not just because one muscle becomes more active, but because the opposing muscle relaxes. In Parkinson's disease, rigidity comes about when, in response to signals from the brain, the delicate balance of opposing muscles is disturbed. Postural instability. Postural instability, or impaired balance and coordination, causes the patients to develop a forward or backward lean and to fall easily. When bumped from the front or when starting to walk, patients with a backward lean have a tendency to step backwards, which is known as retropulsion. As the disease progresses, movement such as walking may be affected. Patients may halt in mid-stride and freeze in place. possibly even toppling over. Or patients may walk with a series of quick, small steps as if hurrying forward to keep balance. This is known as fascination. Parkinson's disease causes motor and non-motor symptoms. Motor symptoms include stoop, shuffling gait, decreased arm swing when walking, difficulty arising from a chair, micrographia, lack of facial expression, slowed activities of daily living, and difficulty turning in bed. Non-motor symptoms include diminished sense of smell, low voice volume, painful foot cramps, sleep disturbance, depression, constipation, drooling, increased sweating, urinary frequency or urgency, male erectile dysfunction. Treatment and management of Parkinson's disease. Unlike for many other neurodegenerative diseases, there is effective treatment for the symptoms of Parkinson's disease. For most patients, these treatments can provide several years of satisfactory treatment. Unfortunately, no therapy has yet been conclusively shown to slow or reverse the disease. 5 classes of drugs are used to treat the motor symptoms of Parkinson's disease.
Dopaminergic agents, example of which is levodopa. Levodopa is a type of amino acids which are contained in certain foods that are building blocks of protein. Levodopa is converted in the brain into dopamine, the same chemical created by substantia nigra cells used to control movement. Dopamine agonists. Dopamine agonists are drugs that imitate or mimic the action of levodopa in the brain by directly stimulating dopamine receptors. COMT inhibitors. COMT inhibitors prolong the effectiveness of a dose of levodopa by preventing its breakdown. MAO-B inhibitors. These inhibitors slow down the breakdown of dopamine in the brain. These are oral medications approved as adjunct in the management of Parkinsonian patients being treated with levodopa, carbidopa. Anticholinergic agents have limited role in Parkinson's disease. They are primarily effective against tremor and rigidity, and their side effects may be significant, especially in elderly patients. Nursing care. Clients with Parkinson's disease have complex and ultimately multi-system needs. Deficits in mobility and self-care are common. Major considerations in caring for clients taking medication for Parkinson's disease are conducting baseline assessments, controlling side effects, monitoring for adverse reactions, and teaching. On safety. Performing ROM exercises maintains joint mobility, promoting better function and strength, improving gait pattern. Ambulation fosters independence and self-esteem. Adaptive equipment improves balance, protects joints, and promotes proper anatomic positioning. On safety, safety measures prevent potential complications that may result from fall or other accidents and promote self-esteem through self-care. Parkinson's disease is a disorder common in older adults who are at greater risk for falls resulting from orthostatic hypotension, osteoporosis, poor vision, and other problems causing disorientation and confusion. Communication. Diminished vocal amplitude and loss of muscular control can impair the client's ability to speak. Developing methods of communication decreases anxiety and isolation. Teaching preventive measures is extremely important when caring for clients who have Parkinson's disease. Preventing malnutrition, falls, and other environmental accidents, constipation, skin breakdown from incontinence or immobility, and joint contractures requires much teaching and reinforcement. It is wise to advise client and family that although Parkinson's disease has no known cure,
Its severity and symptoms are manageable through the combined efforts of the client's partner, family, health team providers, community, and the client himself.